Hey everyone, hope you all are doing well in this COVID situation. As you read the topic, we are going to discuss about the great concept given by PhyX known as concave convex rule. The rule is the backbone of all the mobilization concept or the manual therapy. So this is your mentor Ishant Kumar Arora. Welcome to PhyX Pain Solutions. So basically today we are going to master this concept of concave convex rule, and we are going to deal with the application of this rule. So as you all are aware, the articulation between the two joint surfaces or two bone surfaces form a joint where this articulation help a joint to move in certain direction and help a person to perform a task. So basically there are two types of movement which help to a joint to perform a movement in a particular direction or by our own will. There are two types are the physiological movements and accessory movements. Physiological movements are the ones like flexion, extension, which you can perform by your own will. But there are some accessory movements known as glide, slide, roll, which you can't perform by your own will. So this is also known as arthrokinematics. Arthro means the joint and kinematics means movement. The study of the movement of the joint is known as arthrokinematics. Before starting the video, I presume that you all might aware of the terms like roll, glide and slide, or you can also see the structure of these movements at my extreme right side. So basically next thing is we know that a joint surface is formed of a convex part and a concave part, and they articulate with each other to form a joint. Let's say example of the shoulder complex, where the glenoid cavity articulate with the head of the humerus, and this is the shaft. This is the head of the humerus, and this is the glenoid cavity, and this is the shaft. Suppose I want to abduct my arm. For that I have to perform this movement, but this is the physiological movement. What are the accessory movement that occur between the joint surfaces, between these convex and concave depression like structure? That is, whenever I abduct my arm, this is the neutral position, and when I move like this, I abduct or move in the superior direction, what happens? The direction of roll will always correspond to the shaft of the bone. The direction of shaft movement will decide the direction of the roll, whereas the glide component, you can see that as I am abducting my arm in the superior direction, the articulating displacement between these movements, this bone or head of the humerus is moving downwards and the shaft is moving upward. And as I already mentioned that the direction of the shaft of the bone will decide the direction of roll. So here in this movement, what happening that the direction of abduction movement is superior direction and glide is in inferior direction. So we can conclude the first law of concave convex rule is that whenever a convex surface is moving on a concave surface, the direction of roll, that is correspond to the shaft of the bone always, and roll is always opposite to the glide component of the bone. So we can the next law we can see that suppose a concave structure is moving now. We had talked about the convex structure, and let's say the example of knee joint, where the articulation is between the femoral condyles and the plateaus of tibia. Suppose the plateaus of tibia are the concave surface that has a depression in between them, which give place to the articulation for the femoral condyles. So it is like that. Suppose in the sagittal plane, when I want to flex my knee joint, so what happens that this convex surface is moving, the shaft is also moving upwards and glide is also occurring. Glide is the displacement between the two articulating surface is also upward. So here we can conclude that whenever a concave surface is moving, the direction of roll and slide will always be in same direction. So this is the law of concave convex rule. Hope you understood it. Now we are going to talk about the application of concave convex rule. Suppose, as I already mentioned, that this is the backbone of backbone of manual techniques. So what happens? Suppose a patient comes to you and you want to give him basic glides for adduction. Suppose he cannot perform abduction properly because of adduction. He has a decreased range of motion, and you want to give the glide. So in order to give a glide or give manual therapy, you must be confirmed about the accessory movement that is occurring while performing that physiological movement. So in order to perform that, you must be clear about the concave convex rule and the accessory movement. As I already discussed, that whenever I am abducting the arm, the roll will correspond to the shaft of the humerus that is moving superior direction. So roll is in upward direction, and glide will in opposite direction, like this. It is moving downward. Glide is between the two, displacement between the two articulating surface, and the roll is corresponding to the shaft. So the shaft of the is moving upward, so roll is in superior direction and glide is in inferior direction. So this is the basic application of concave convex rule. So hope you like the video. Share your valuable feedback in the comments. Stay tuned, stay healthy. Thank you. Next time.